Everyone, I am Rohit Vats, and today we are with doctors, some very senior ones, and we are going to talk about the World Health Day, which is today, and the theme of this year is Health for All. But before proceeding, I will introduce all the doctors one by one. We have Dr. Wali, we have Dr. Dipali Bhadwaj, we have Dr. Anand, and we have Dr. Manishankar. So, welcome to the show, doctors.
Thank you.
Thank you.
So, without without wasting much time, let's directly come to the point. So, Dr. Wali, how do you see the health condition in India as of now? What are the areas where we need to improve immediately?
Yes, health conditions in India were always very good. We still are progressing towards a better tomorrow. And primarily, I see that the healthcare in villages should improve what we call it primary health care, and our primary health care center should be rejuvenated like they were working in the past, and some new should be opened. We have a great network of ASHA workers which is nowhere in the world, and that has to be activated. Then India, on if you see on the brighter side, we are the best place for the world for medical tourism. So both ways we have to go ahead. We are already very good in providing very cheap and affordable medical care. Our medicines are very nicely priced, very appropriately priced, and we are able to produce the best doctors, and our doctors are doing the best services around the world. And we have another advantage of having Ayurveda. We have Ayush system now developed, and Pradhan Mantri Modi ji has propagated a very powerful message that we should go to our traditional medicine, and we have to improve in this direction also and make it global mention as
At
well.
this point in discussion, I would also like to bring in Dr. Anand because Dr. Wali is presenting a very rosy picture. But is this the reality? Is this actually the situation on the ground? Dr. Anand, you are already on the ground, so you tell me.
Now, see, I quite agree with Dr. Ali because despite the COVID pandemic which happened, and uh, having worked closely with the TB program and the National TB Elimination Program, we thought that the one disease program which would be affected very severely would be TB program. But fortunately for us, and fortunately for the leadership in our country, the TB program was, kind of taken well care of in the sense that we didn't recede too much on the achievement front in TB program because of the pandemic called COVID.
I will take the same question to Dr. Dipali because I understand that we are sitting in Delhi NCR where we are relatively in a better condition as far as healthcare is concerned. But Dr. Dipali, do you think that even far areas very far from national capital would be having same kind of facilities? Because during recent COVID crisis, we have seen what has happened.
See, Rohit, leave COVID behind, which was an exception. I agree with both the doctors' comments, but it's more of a rosy picture in my view. I feel in our country, till the time population is not controlled, we will not be able to deliver healthcare for all. Even right now, as per statistics, I think we are almost one doctor per 12,000 or 3,000 people. The best thing about this government is in the current budget, they have said that they will be increasing the number of colleges, which is a very good news.
डॉक्टर मणिशंकर, आपको अभी अगर यहाँ से भारत को आगे जाना है, हेल्थ फॉर ऑल जो इस साल का वर्ल्ड हेल्थ डे का थीम है, अगर उसको इंश्योर करना है तो आपके हिसाब से वो कौन से एरियाज हैं जिस पर हमको सबसे ज्यादा फोकस करने की जरूरत है?
WHO का पहला जो ये हेल्थ फॉर ऑल का जो प्रोग्राम आया था 1978 में आया था, और आज हम फिर दोबारा इसी पॉलिसी पे 2023 में हम फिर से आ गए हैं हेल्थ फॉर ऑल पे। तो अगर इतने सालों के बाद हम हेल्थ फॉर ऑल को फिर से रिपीट कर रहे हैं, इसका मतलब है कहीं ना कहीं शॉर्ट कमिंग्स हैं।
हाँ, लेकिन इसमें एक तर्क ये भी है, एंड दिस इज अ क्वेश्चन फॉर ऑल ऑफ अस, दैट अगर if we are repeating the same thing, also the challenges that the world faced in 1978 are and what we are facing now are very different. So of course we will have to go back and revisit and figure out what exactly we did right there and what we can do now. So coming to you, Dr. Wali, So, what do you think are the areas? Like, for example, India fought really hard with tuberculosis. Before that, Kalazar, and we also saw a huge fight with polio. So, what do you think are the areas where we should go now?
A big area in which we have to be very careful now is non-communicable diseases. We should start the work at schools, places where the young generation is there, offices. Like we should see that how the future of the India is going to change with this cluster of non-communicable diseases. Primary health level should also include non-communicable diseases.
Non-communicable. It's a very valid point you have made,
Yes.
Dr. Wali. And this non-communicable disease. Now, again, I am going to Dr. Anand. So, Dr. Anand, non-communicable disease, even in the professional world, we have seen people who are around 30, 31. They are suffering from diabetes or hypertension or most of such diseases that Dr. Wali mentioned. This this wasn't the case some 15 years back or 20 years back. So, what has changed in between last 10, 15 years?
As Dr. Vali put it, it's a lifestyle which has changed. But I'll go one step back and I'll try to reiterate the emphasis of preventive health. Because we are at a crux where we are suffering both the brunt of the infectious as well as the non-infectious diseases or the non-communicable diseases. Now, what we have to do is we have to get the bang for the buck, in the sense that we have to understand the money which we are putting in, the percentage of money and how much returns we get on that investment in terms of curative health or preventive and promotive health. Now, if you don't actually have clean water supply, okay, you can keep on treating diarrhea, typhoid, etc., and all waterborne diseases, but you never come to an end point. Similarly, if you don't change lifestyles, you can keep on treating, you can keep on diagnosing hypertension, obesity in children. But the emphasis, the importance of preventive health can never be overemphasized. And if you really want bang for the buck, all our money should go into preventive health, or
Yes.
most of it should
So
go into
preventive,
preventive health,
you
and
made a
we
very
should
valid
try
point
to.
there. That preventive healthcare is very important. Apart from before making it available for all, like we should be prepared for it. So,
Yeah.
Dr. Diwali, again, how easy that would be in given in current condition?
Our country is rich with yoga science. Better health, better eating, millets, eating healthy is important, which everybody can afford. Simple dal, हम सबको रोज खाने को मिल सकती है. And most importantly, we need to do some sort of a mental health के ऊपर काम. जो ये stress levels बढ़ रहे हैं, all that is important.
Dr. Mahishankar, I was wondering that take a very close look daily in the conditions that our hospitals are, the kind of equipments we need, the kind of patients we are getting from all over the country. What do you think is the ideal time duration by which, by the end of it, suppose it's 20 years or 50 years or whatever, by which we will be relatively successful in our pursuit?
Clear-cut target cannot be fixed, first thing. To do anything, we have to first, our intention should be cleared.
At this point of time, I would request you for a quick final comment.
India is a country of hope, and we have always survived, and we have done our best. See the example of 200 crore vaccinations. What we can achieve, we can do, and I will not politicize.
I'm very hopeful. I'm a very hopeful person. So I'll start by saying, number one, again, I'll reiterate the fact that we should focus on preventive health. We should do proper multi-stakeholder identification, fix the roles, fix responsibilities to people. Okay, we should educate people. We should promote behavior change and communication.
Population, 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 3 points cover. They really need a sharp control. हम दो, हमारे दो या हम दो, हमारे एक हो जाना चाहिए.
हमारा ये है कि पंचायती राज को जैसे मजबूत करना है, उसी तरह से हम हेल्थ को रूट लेवल से मजबूत करें. अगर पीएससी मजबूत होगी, पूरा इकोसिस्टम मजबूत हो जाएगा.